Good morning, everyone. That was a difficult act to follow. Thank you so much, Wendy, first of all, for those remarks and for sharing your story. I really appreciate it. As a Unitarian Universalist, we often say when we give offering that it's a blessing to be able to give and it's a blessing to be able to receive. So that message really resonated with me this morning. So thank you, Wendy. So it's an honor, really, to be here amongst people who believe that healthy food is a human right and not a privilege. It's actually written on the building. It says that food is a moral right to all who are born into this world. And I absolutely believe that, and I think we all do. Thank you so much to the World Food Prize Foundation for inviting me to participate in today's summit. I'm Allie Hard. I am the Public Policy Director for the National WIC Association. And I wanted to start this morning by sharing a short personal story as well. In the late 1980s, a young couple left China to finish their education and start a better life a few hours away from here in Kansas City. While completing their doctoral studies and waiting tables and washing dishes in local Chinese restaurants to make ends meet, they were referred to WIC to get support as they were expecting their first child. That was my husband, Mike. A little bit of help from WIC for their family made an enormous difference for them at a time when they needed it. A few decades later, they've built careers in the United States pharmaceutical industry, developing life-saving cancer drugs and even the first drug to treat COVID-19. They also recently welcomed their first granddaughter, my daughter Lily. This journey is just one example of how WIC helps families build strong foundations from the ground up. Today's theme, From the Ground Up, speaks to the power of local solutions that drive national change. And there's really no better example of that than the Special Supplemental Nutrition Program for Women, Infants, and Children, a program that has been nourishing families and communities for 50 years. WIC started as a pilot in Baltimore, Maryland, where a pediatrician from Johns Hopkins, Dr. David Page, had a revolutionary idea of providing a healthy food package as a medical intervention for pregnant moms and young children. Today, WIC is a nationwide public health nutrition program that provides science-based nutrition education, breastfeeding support, healthy foods, referrals to healthcare and social services, and more to nutritionally at-risk and low-income, postpartum, pregnant, breastfeeding parents, and children up to age 5. Here in Iowa, WIC is under the leadership of their director, Brandy Benedict, who is here today, somewhere in the audience. She'll wave. There she is. Hi, Brandy. WIC serves almost 62,000 participants each month here in Iowa, empowering parents, improving birth outcomes, and giving children a stronger start to life. WIC serves families in all of Iowa's 99 counties, and last year, WIC families redeemed $58 million of benefits at grocery stores and farmers markets here in Iowa, really pumping money back into the local economy. But WIC's impact goes beyond numbers. Studies show that WIC participation reduces food insecurity, lowers infant mortality, and improves child development and school readiness. It's a testament to what happens when we invest in prevention, equity, and the health of our next generation. Iowa has long been a pioneer in making WIC more accessible and responsive to families' needs. Just last year, Iowa became one of the first states in the nation to launch an online shopping pilot with Hy-Vee, allowing WIC participants to order groceries online and pick them up at the store, which has been a game changer for working parents, rural families, and anyone balancing the demands of a busy life with putting healthy food on the table. So as I said earlier, I work for the National WIC Association, or NWA, and we're a nonprofit organization that represents state and local WIC agencies across the country. Along with providing education and resources, we advocate for WIC at the federal and state levels. Like many of you, we are deeply disappointed and concerned about the cuts to programs like SNAP and Medicaid in the One Big Beautiful Bill. Although WIC was not directly cut in this legislation, many participants could lose their adjunctive eligibility for the program if they lose their SNAP or Medicaid benefits. This was a difficult loss, but our work to protect and expand programs like WIC is far from over. Looking forward, we are focusing on 3 key policy priorities. First, full funding for WIC. WIC is a discretionary program, meaning that Congress needs to renew its funding every single year. Participation in WIC is rising because of inflation, rising grocery costs, and the expiration of other federal supports, and we anticipate that will be even more so after the passage of reconciliation. We need full funding to avoid wait lists and ensure that every eligible family is able to benefit from WIC's critical services. Second, protecting the monthly fruit and vegetable benefit, or the CVB, the cash value benefit in WIC. The CVB was increased in WIC in 2021 based on recommendations from the National Academies of Sciences, Engineering, and Medicine, or NASEM. Studies have shown that since the increase, WIC families are consuming more produce and a greater variety of fruits and vegetables. The House budget proposal would cut the CVB by 10% this year. And the chairman has indicated that this is just the first step in achieving what the president has proposed for long-term cuts to the cash value benefit in WIC. Finally, sustaining remote services. Flexible service delivery, including video or phone appointments, is critical to meeting modern families where they're at, especially in rural areas. WIC has been offering these services since 2020, but without congressional action, these options may expire in in September of 2026. So at NWA, we are closely monitoring critical issues like these that could impact WIC families. We're building relationships with key officials at USDA and in Congress, and working with partners to protect nutrition programs and provide resources where needed. We will continue to advocate fiercely to ensure that WIC remains fully funded and accessible to all. As we discuss hunger here today, let's remember that with strong policies and investments, we can build a future where no parent has to worry about being able to feed their child. So let's roll up our sleeves from the ground up and keep fighting for a healthier, more equitable food system. Together, we can make that happen. And I'm so grateful today to be joined by a fantastic panel. We have local WIC staff and our retail partner Hy-Vee, and we're going to talk a little bit about how innovations like online shopping and remote services are transforming the WIC experience here in Iowa. So I'm going to briefly introduce them now, and then I'll ask them to introduce themselves in more detail. So first we have Yolanda Pina, and she is a breastfeeding peer counselor at Broadlawns Medical Center WIC. To her right, we have Lindsy Carroll, who is a nutrition educator. To her right, we have Stacey. Sorry, we have switched order here. To her right, we have Stacey Loftus, who is the e-commerce supervisor for Hy-Vee, Inc. And then to her right, we have Lindsy Carroll, who is a nutrition educator for Broadlawns Medical Center WIC here in Des Moines. So just give me a moment to get seated with you all, and we'll get started with our panel. Had to make sure I had water, just in case. All right, so I think we'll start with Lindsy and Yolanda. Can you introduce yourselves a little bit more detail and tell us a little bit about your job and the opportunities that you have to improve nutrition security in your work for mothers and families with young children here in Iowa?
Yes. All right, so hi, I'm Lindsy. I have been working with the WIC program as a nutrition educator for just over a year now. And actually, before I was working at WIC, I was a WIC participant myself through my pregnancy and postpartum period. Before that, I had graduated from Iowa State with a degree in dietetics, and I started my career as a dietary manager in a local nursing home. And then I found out I was pregnant, and I had to make the decision that a lot of families have to make, whether to continue pursuing my career or to kind of take a step back and focus on my family. And that's what I did. I focused on my family and sacrificed a little bit of my financial independence in doing that. I'm so glad I did that, and WIC was there to help me when I was going through that vulnerable period. They helped me with my breastfeeding journey. They helped me, give me support while I was trying to figure out what to do in this new stage of life. And it was also really nice to have that food security, that blanket of security. Something that I didn't have to worry about was if I was going to have enough bread and eggs. And then that inspired me to help give back to my community. So now I'm a nutrition educator at WIC, and I get to help give that support to families.
Thanks, Lindsay. Yolanda?
Hi, I'm Yolanda. I'm a breastfeeding peer counselor at Broadlawns WIC, and I've been with WIC for probably 4 years now. And I was in WIC as a participant for my 3 children during pregnancy and breastfeeding, and they helped me during a time of need. It helped me understand what kind of foods to eat during pregnancy, how to feed my little ones as they grew, and they gave me a lot of support through breastfeeding, because breastfeeding is really hard. And I will always be grateful for the resource, the guidance, and the care that they provided. So now in my role, I get to give back. I get to help the moms, support them, and be there for them as somebody was there for me as well. So yeah.
Thanks, Yolanda, and I absolutely agree. Breastfeeding is really hard. Well, great, thank you. And Stacey, as you introduce yourself, can you tell us a little bit about Hy-Vee and what they are doing to help bridge the gap in food access for children here in Iowa?
Absolutely. So I've been with Hy-Vee for 18 years, just about. I started as an in-store dietitian and then transferred into the office. Was there as a corporate dietitian. When COVID hit in 2020, was asked to transition into the e-commerce role as that started booming, and have been in that role for about 5 years. So as we're bridging the gap with Hy-Vee, Hy-Vee is just a really great community partner. We do a lot of partnerships with Food Bank of the Heartland. We have WIC, SNAP. We do a lot of local partnerships as well. So just speaking on WIC, in the last year, we've been able to expand our in-store offering to online. And so we are currently available in Iowa, Nebraska, Minnesota, and soon South Dakota. So very excited to keep expanding that. And then we just continue to focus on our pricing, our private label penetration, our variety, and then actually something that we also are just finishing our rollout on is our SNAP EBT, and to be able to offer delivering with that. So very exciting.
Thanks, Stacey. So going back to Lindsay and Yolanda, sometimes I think folks who don't know too much about WIC might think that it is just about food. Can you tell us about how WIC does more than that? How does WIC support education, breastfeeding support for moms, and overall maternal and child health?
So for me, as a breastfeeding peer counselor, I get to work closely with moms and support them through their breastfeeding journey. WIC is often the first place that moms turn to for after having their babies. So early support, I feel, is key to get moms on the right path. And through the peer counseling program, we offer guidance with challenges, access to like lactation consultants and support through us on a daily. It's text messages or phone calls, always checking in on moms. And for a lot of moms, again, that's what helps them stick to it and get started. And what really makes this program special is that we build moms to feel supported and heard, and it's like we're a big family.
Thank you. Lindsy?
Yeah. So as my role as a nutrition educator, we do a lot with our participants. We do a health screening, so we are evaluating or taking measurements on height and weight and anthropometrics and blood work to screen for common problems in this stage of life, like anemia. And so we're often catching things that doctors are not catching if they're not going to their doctor's appointments. We also offer nutrition counseling. So we do this through a person-centered care approach. And so we're opening the door to any questions that they have, anything that's going on in their lives. And then we can tailor our nutrition education to what they need in that moment. And by doing that, they trust us more, and they are more receptive to the information that we're giving them. So so that the opening of the door kind of brings in a lot of problems that maybe we're not qualified to handle. And so we act as a resource hub. We help send out referrals to other community resources. Yeah, so WIC does a lot more than just giving out food benefits. We help in all areas of someone's life.
Thanks, Lindsay. And I think that point you made about catching things sometimes that maybe, they're not getting into their, their physician's office as frequently as they're coming to WIC. And so WIC can really be a critical place for us to catch things that are going on early. And that's why I think folks have really looked at WIC as also a solution as we think about addressing broader maternal health crises. So thank you for that. So Stacey, back to you. We talked about how Hy-Vee was one of the first retailers in the country to do online shopping with WIC, which may sound kind of wild, but WIC really, we're still piloting online shopping. So actually, as I mentioned, Iowa really is a pioneer in that too. Can you tell us a little bit about how that's been going? What are you seeing in terms of outcomes? And how is that helping families to have that option?
Absolutely. Well, we are all busy, right? So it is a huge time saver for families. And not only is it time saver, but it is helping with budget planning, just meal planning to make sure that we have those balanced meals on the table. The nice thing about WIC and what we've implemented here is you connect your WIC account to your Aisles Online Hy-Vee account, and then it's all in the payment section. And so you can see exactly what your benefits are, how much you've used, when you've used them, what you got left for the month. So that's really critical, and just making sure that we're utilizing those benefits to the max. And then also when they are shopping online, as you're scrolling through, we have attributes listed that show exactly what are WIC eligible items or SNAP eligible items as well. So it makes the shopping just a little bit easier. And then with WIC as well, we offer delivery. So just when you're time consumed again, transportation might be that burden for some, we offer that delivery or pickup, whatever is easiest for a family. So definitely still, getting through that first technology rollout, but it's going really well, and we're excited to keep and continue to expand that offering.
That's great, thank you. And I think that really addresses one of the key, I think sometimes challenges of WIC. One of the best things is it's a prescriptive food package, it's healthy foods, but then the challenge is that sometimes it's hard when you're at the grocery store and you have, very specific this size, box of cereal, and, just finding and identifying that. So I think having that option for online shopping also helps address that, right? Where you can just see, okay, this is WIC eligible, I can buy it. So I think that's great. And I'm curious, Yolanda or Lindsay, have you heard any feedback from your clients about the online shopping yet?
Yeah, they love it. They love being able to just see what they can buy that's WIC eligible, because it's really hard to find some of these foods, especially when you're new to WIC. So yeah, they love it, and they love being able to just pick it up with their busy lives. It makes their lives easier.
Yeah, I would say the same. I get to hear the same thing.
Great, that's awesome. Well, back to Lindsay and Yolanda, a question for you about the cash value benefit. So we talked about how there was this really significant increase in 2021. We went up from about $9 a month for children, which if you can imagine, certainly, I'm from DC, but I imagine even here that really doesn't get you very far, right, with fruits and vegetables. So they went up from $9 a month to about $26 a month for kids, and then about $11 for moms, to about between $47 and $52, depending on what package you're in, if you're breastfeeding or not. So a really significant increase. And then we've been kind of the last couple of years doing this back and forth debate about whether to keep it or roll it back. So I'm curious, from your perspective, how are the participants responding to that level? What are you hearing from them about that?
So the cash value benefit, the money for fruits and vegetables, is so important for these families. It's the easiest to buy, like we were talking about. It's so hard to find some of the WIC foods, and so having the money for fruits and vegetables is the easiest. It's also the most versatile. There's so many different cultures we're working with who don't always use peanut butter or know what to do with like Kix cereal. They've never heard of that before. So every family uses fruits and vegetables. And it's also the healthiest option. We could all use more fruits and vegetables in our diet. And when you're setting aside a budget for fruits and vegetables, they're gonna be buying it and they're gonna be eating more of it. And this is gonna help with, short-term and long-term health results.
In my role, I feel moms, when they're breastfeeding, exclusively breastfeeding, that increase really motivates them to continue. And personally, when I was on WIC also, I feel like it was really exciting. Like, there was more veggies and fruits on the table for my kids. When my daughter got to be 6 months, it was really fun to be able to mash the vegetables or the fruits and see her try it, and not where Gerbers are good, but it was a different experience. I enjoyed it a lot, and personally, it was very helpful.
That's great. Yeah, and we hear things like parents are willing to try more different types, right, of fruits and vegetables when you have a little wiggle room in your budget, right? If you don't have that wiggle room, you're going to probably go with the thing that for sure they're going to eat, right? But you might not be able to try, newer types of fruits and vegetables. So I think it's great, and that's where we're seeing that in the data too, right? We're seeing people buy more types of fruits and vegetables with this bump. So it's great. Excellent. So I think we talked a little bit about before, but just wondering, if you can talk a little bit about, we talked about this from online shopping, but the other thing that's happened in WIC in the last 5 years is remote services and the flexible service model, where someone could really choose if they want to come into the clinic or if they want to do an appointment by phone or by video chat. And I think we've seen that be really, really important. So curious to hear, from your perspective, what is that like for families? What kind of difference does that make? And if that were to go away, what would that mean?
In my role, I work mostly from home. So those quick phone calls and text messages, I feel the mom responds right away. Because sometimes I've run into, we schedule something in the clinic and they don't make it. They, they didn't have a ride. They, got busy with the baby. So it's a lot easier if they'll sometimes send me images or voice memos. So it's really quick. I can message them and reach out to them, and just build that peer-to-peer relationship. And I feel like they can trust me, and so I feel like with the phone calls and the text messages, it's a good thing for the parents.
Yeah, our families are facing so many barriers, like transportation and illnesses. it eliminates those barriers to be able to do it online or over the phone. And we can do this. We have all the tools to do it. We can work with our healthcare providers to get the information we need for the health screening. And it just, it helps eliminate those barriers to be able to do it online.
So if it were to go away and everyone had to come back, into the clinic, what do you think that would mean for your participants?
Definitely the participant rate would go down. I mean, already it's hard for these families to keep their appointments, and then adding that extra burden, we would start to lose people.
Yeah, I agree. Because they even sometimes will reach out and ask just quick, like, oh, can you have a dietitian reach out to me? And it's a quick, yeah, I can schedule it on the schedule, and someone reaches out from the office. So I think it would be very, they wouldn't go into the clinic as often.
Thank you. So Stacey, can you share a little bit about, for some families, they still do want to come into the grocery store. I know sometimes I like to go in and, pick out my own produce, right? How are you all working with families who do want to come into the grocery store and they're using WIC? How are you helping them kind of navigate that challenge of the WIC foods?
Absolutely. So one of our goals is to really make whatever we offer in-store, online, and vice versa. So we're trying to really bridge that gap of the same experience you can experience whether you're shopping in the store or online. So currently today, and we've had this for quite a while, but we do have the WIC eligible signage on the store. Something new that we are going to be rolling out here in the next month is a product location mapping. So you can actually utilize the app if you are looking for a specific item, and it'll tell you the exact 4-foot section in the grocery store and where to find that. And then you can at the shelf look for that WIC eligible marking as well. Another thing is, whether you're again online or in the store, is a seamless transaction. So our employees typically don't know if you're a WIC participant or not. So I think that just gives some confidence too, whether you are shopping in store or online as well.
That's great. That's so nice to not have that. I know, I think back to the days when WIC was all paper checks, and it was hard, I think, for families who were going through and, dealing with the check, and sometimes the cash register, the folks were not trained necessarily in that, and so it would take longer. So just what a new day we are in, where you don't even know that's what they're paying with. I think that's absolutely, how it should be. And that's the locator. That's amazing that I want that.
You can have it too. And it's
Great.
for everyone.
That's amazing. Thank you. So we're getting closer to the end of our time here. We've got a little bit of time. But I want to ask all of you, if there was one policy or systems change that you could make right now, if you had, a magic wand, let's forget about, Congress and all that, just a magic wand, what would you do? We can start. You want to start, Yolanda?
I would continue to support community-based. It's such a big help, and taking away funds or, not giving that help to people that are in need, it's gonna be something that hurts a lot, the whole community. Just an idea that I've gotten into gardening recently, so I thought maybe in the future, opening up a garden for the whole neighborhood. I know sometimes when I love to make spicy food, so I need a jalapeno, I need a serrano. I'm going out to my garden and grabbing it. So it's something where like the clients can go out down the street or even cross the street and get fresh vegetables and fruits. I think that would be something that I would love to see in the future.
I love that. Maybe gardens at WIC.
Yeah.
Great idea.
I would personally love to see a subsidy around delivery for WIC, just as a benefit, even SNAP as well. We offer a membership for $99 a year, so you're looking at less than $2 a week for delivery, unlimited delivery. And if transportation is a barrier for some families, or as the ladies mentioned, If the online part goes away, the participation goes away. So just getting that accessibility out to the consumer is a big piece of that. I'm actually involved with the research project. I'm the e-commerce partner for Creighton Research grant that they are really focused on low-income families. We're about halfway through that research, and it'll be interesting to see that outcome. We have about 2 years left. So it'll be interesting to see if that data can help support getting that delivery mode out to consumers and if that has an impact on their health as well.
So the biggest problem I see that families are facing is just they're living paycheck to paycheck, and so having to take time off of work that's most of the time unpaid to have a baby or start a new family, it's making it really hard for them to put food on the table. So I would advocate for having paid maternal and paternal leave for families. We're one of I mean, it sounds like you guys already know, but we're one of the only countries that doesn't have this paid leave. And it's no surprise that our maternal mortality rates are one of the highest in the world for a developed country. It doesn't have to be this way.
Thanks, Lindsay. That's very well said. And I think we, at National WIC Association, we think about that connection too. It may not be obvious, but having that paid leave and the time to be, especially with your newborn, really helps with breastfeeding. It's very difficult when you have to go back to work. I went back at 3 months, and even at that point, it was like, okay, got to deal with the pumping and the this and the that, and it's really, really hard. So I think, if we want to advance breastfeeding and make that easier for folks, we have to think about that connection and the workplace support. So I absolutely agree. I think that is a nutrition priority for sure. Mm-hmm. Well, thank you. I want to ask folks if there was anything else you wish I had asked or you wanted to share before we wrap up. All right, that's okay. Well, I will repeat some of the things that you all said. I think, this was a great conversation, and a few of the things I heard, it was great to hear, I think, from both of you who were WIC moms and who stayed and then got involved as employees of the program. I think that really shows, and I think, Yolanda, you said it, that WIC is a family. It's a fantastic place where we are doing wraparound services and supports. And it's a place where I think people really feel comfortable when they come in and are able to get what they need and stay. So I think WIC is an incredible model. It's very bipartisan. It's probably one of the most bipartisan programs historically in our country, which is fantastic. I think that's part of why we've had it for 50 years. Unfortunately, I think, as I mentioned in the beginning of my remarks, there's a couple of things that have been very difficult and made it a little harder in the last few years. So I'm hoping that we can kind of continue to lean on the fantastic bipartisan elements of this program, the absolutely incredible outcomes that we see for reducing infant mortality, for actually saving money. We know that for every $1 in WIC, we are saving at least $2.78 in healthcare for each dollar. So, and that's probably an underestimate. So I think this is an incredible program with a lot of potential, and one that needs ongoing support and advocacy. We can't just sort of let it slide and go. As I mentioned, it's an annually appropriated discretionary program. So we can't forget about it. We have to keep paying attention and advocating for this incredible program in order to keep it going. So I think we're gonna wrap there, and I want to just thank our incredible panel. This was fantastic. I'm so honored to have shared the stage with you all this morning, and I also just want to end by thanking the World Food Prize Foundation for having me, and I hope as we go into this week where we're honoring the legacy tomorrow of the incredible Congressman John Lewis, I hope we're all thinking a little bit about how we can get into some good trouble this week. So wanted to end with that. Thank you.